Joining me now on CGTN is Dr. Harley A. Rotbart, author of the book No Regrets Living, 7 Keys to a Life of Wonder and Contentment. He's also Emeritus Professor of Pediatric Infectious Diseases at the University of Colorado School of Medicine. Thank you for joining me today.
Thanks, Rachelle. It's nice to be here.
So I want to first start by helping our audience understand just how much children have been affected by COVID, especially now with this Delta variant in play.
Well, we've been blessed in a way, if there is a blessing to be found in the COVID-19 pandemic, that kids have been relatively spared not only of infection, but spared of severe infection, of hospitalization and death. That's not to say that it hasn't been serious. Kids have gotten serious disease and there have been some deaths, but for the most part, kids have not been a major factor in the transmission of the virus or in the morbidity and mortality and the severity of the infection.
Now, as we look at children in the older age group, talk about the vaccination rates for those aged 12 to 18 and what we're seeing with the rates and whether they're too low.
Well, they are too low, and there are reasons for that. Parents are always hesitant to have their kids experimented on, if we want to use that word. And as long as the approval for the vaccines has not been complete, it has been for emergency use only, many parents have been hesitant without full FDA approval to have their kids vaccinated. That said, the data are extremely positive regarding the safety and the efficacy, the effectiveness of this vaccine in kids over the age of 12. And the studies are now beginning, and actually some are well underway for kids between the ages of 5 and 11.
And as we've seen, unfortunately, is the case with any new development, there's also a lot of misinformation that gets spread online. Talk about the different efforts being made to reach some of these in the 12 to 18 or the younger children's groups, and what can really be done to address their concerns?
Well, I think that the best thing we can do is be role models. And there are so many adults who have not yet role modeled getting vaccines so that their kids see that it's safe and that they feel that it's safe, adults feel that it's safe for their kids. So first and foremost, we need to get the 1/3 of adults in the United States who have not been fully vaccinated. And when we do that, the actual importance of immunizing kids is going to be reduced. And the compliance with immunizing kids will be increased. So adults will role model, but when we get the majority of adults in this country vaccinated, the importance of immunizing kids will go down somewhat because they will no longer be able to spread it to vulnerable adults.
Now, I want to turn to the summertime. Obviously, we're in the throes of summer, but some schools or camps have also started, are still open. Now, we have heard increasingly about some of these outbreaks, some of these sleepaway camps. And as someone myself who is trying to enroll my daughter in different kinds of camps, the safety measures vary very, very widely from one camp to another. Was it expected then to see a spike with some of these sleepaway camps?
I think we should expect that. And we also have to expect that depriving kids of the social experience that is so beneficial of summer camps, sleepaway or day camps, is also a risk that we put kids through, as we put kids through the risk of staying out of school when we close down schools. So it is a risk-benefit analysis, but there are clear safety measures that camps can institute to protect kids and to still provide the enjoyable summer experience that they have. Masking indoors is important. Distancing indoors and density reduction, that is having fewer kids in a cabin, having fewer kids or shifts for meals, will reduce the transmission rate. Careful hygiene measures at camp will reduce the transmission rate. So there are mitigation strategies to protect kids without depriving them of the summer camp experience.
So then what does this information tell us about what we can expect then for the start of the school year?
Well, we have evidence from the previous school year that schools are not major sources of transmission within the school or outside of the school in the community when kids go home. The schools have not been the villains in this outbreak. They are in some outbreaks. The reason that we reflexively close schools down during a pandemic, as we have for influenza in the past, is because kids are petri dishes. They're amplifiers of infection. They're germ inhabitants, and they do spread infection. But again, we are blessed in a way that with this particular pandemic, schools have not been shown to be major factors, and schools have taken many of those mitigation strategies very seriously in order to prevent the need to once again close the schools.